He was having a mental health crisis. He dialed 911 for help. He was admitted into the hospital, but hours later, he was found dead. That's the story of Michael Sharadin. Andy Parati, you've got this heartbreaking investigation for us. Tell us more about Michael's story.
Yeah, we're talking about Michael Sharadin. He did all the right things. Diagnosed with bipolar disorder in his 20s. He knew he was having a mental health crisis. He called 911, asked to go to the hospital, and when he got there, according to a lawsuit, the hospital didn't do what it was supposed to do to keep him safe. Savannah police respond to a call inside an emergency room in 2024.
So he was like hanging, like his body was like this.
Do you know who initially made that call to security?
Inside this bathroom, a man found hanging from his hospital gown. His name, Michael Sharadin.
I was with him. I was holding him. I had said to the doctor,
Carol is Michael's mom.
I said, "Doctor, how could this happen?" And he said to me, "I don't know." He says, "I don't know."
Before he arrived at Memorial Health University Medical Center, he called 911 from this hotel, begging for help.
Adam 911, where's your emergency?
Hi, I'm having a nervous breakdown.
It happened when the 35-year-old New Yorker stopped in Savannah on his way to visit family in Florida. Diagnosed with bipolar disorder in his 20s, he recognized he was having a mental health crisis.
I don't know what I'm doing. You know me, please.
According to a pending lawsuit, when he arrived at the hospital, staff did not help Michael when he needed it the most, claiming they left him unsupervised when psychiatric patients are supposed to be monitored at all times. According to a police report, Michael was seen carrying multiple gowns into the ER bathroom, locking it from the inside. Security forced the break down to get inside.
I got there and I'm like, "How long's he been in there?" They said, like, "About 30 minutes. I'm like, "What?" I said, "Why they're just not calling us?"
Natalie Woodward is the family's attorney.
Did everything right. He did everything right. His mom did everything right. I mean, I think that's the tragedy of it.
The lawsuit claims when Michael went to the hospital, he should have been taken to a section of the ER reserved for psychiatric patients to wait for a mental health professional, but the ward was closed.
What was the reason for it being closed? You meant staffing.
And he was the only thing that we had outside the department.
What does that mean to you?
To me, it means they didn't have enough nurses to operate that unit. This was something where it was just so preventable and easily preventable. This was literally just a matter of keeping eyes on him and making sure he doesn't hurt himself until the psychiatrist can get there to do what needed to be done next.
Memorial Hospital declined interview requests, but in a prepared statement wrote, "The loss of a loved one is devastating, and our thoughts remain with this patient's family and friends. We're aware of the filing, which we are reviewing, and we will respond through the legal process." While the hospital did not acknowledge if it experienced staffing issues the day Michael died, Georgia is projected to have one of the largest nursing shortages in the country. According to the National Center for Health Workforce, the state will need more than 18,000 RNs by 2037. A National Library of Medicine report revealing that low staffing can lead to higher odds of patient deaths, up to 10%. And the National Council of State Boards of Nursing releasing a report this year citing stress and burnout as the top reasons for leaving the profession. Would you agree with that?
I would say that well-being challenges, resource challenges absolutely are still a concern.
Chelsea Agopian is executive director of the Georgia Nursing Workforce Center and an assistant clinical professor at Emory School of Nursing. So, you may be surprised to hear she doesn't call Georgia's projected need for nurses a shortage.
So the problem with the rhetoric of the nursing shortage is it just ignores the complexities of nursing workforce challenges. So by just saying the nursing shortage, it doesn't give you enough information to define the problem correctly and then have good solutions.
Her organization is trying to figure out where Georgia's nurses are working or not working, to focus resources to medical fields where nurses are needed the most. At the moment, the state doesn't track that information.
If you ask, say, a private practice in Atlanta, they might say, we have plenty of nurses, where we're getting plenty of applications, where we have all of our patients covered, all the nursing services needs are met. But if you're asking, say, a rural community hospital, they may give you an entirely different story.
I could tell that he was pretty anxious.
I have a nervous breakdown. I have a nervous breakdown. I need psychiatric help, please.
A young man crying out for help in a hospital accused of not having enough staff to keep him safe.
And I think if somebody said to me, think of your worst nightmare, I don't think I could have imagined anything worse than that.
The CEO of the National Council of State Boards of Nursing says hospital systems can no longer use COVID-19 as an excuse of why nurses are leaving the workforce, adding that there needs to be more investments to support nurses' mental health. Andy Parati, Atlanta News First, investigates.
We're going to take a moment here to talk about mental health and mental health resources. If you or anyone you know is dealing with a crisis, the number to call is 988. Andy, we know the pandemic changed a lot of things, affected a lot of industries, and possibly our health industry from what we've heard kind of anecdotally here over the last few years. What's that direct through line from the pandemic to the nursing shortage?
Yeah, COVID-19 and the pandemic had a big, profound impact on staffing at hospitals. A lot of nurses left the profession, and we're still reeling from the pandemic and staffing shortages. But according to an executive director of an organization representing nurses, he says that hospitals can no longer say the pandemic is sort of the cause of the problem now, that they have to get ahead of it, that there's a lot of other issues involving shortages in ERs. We're talking about mental health, burnout. And I think the focus that organizations are now saying is, what are hospitals doing to make and retain nurses, then make sure that they're treated well and that they're not burned out, forcing and then going somewhere else to another type of profession.
Yeah, I mean, and you just hit the nail on the head, but let's double down on it a little bit. In that story, one of those expert voices, she was saying it's a nursing shortage really doesn't cut it. It doesn't cover the complexities of these issues, and the issues are really compounded.
Yeah, I was really surprised when I sat across from her and she's saying, we don't call it a shortage, or I don't like to call it a shortage. Basically, what she's saying is that what the state needs to do is really double down in figuring out where these nurses are working. So the Secretary of State's office in Georgia is the entity that licenses nurses. We know where they live, because you have to provide that information on your license application, but it doesn't identify where they're working or sort of like the sector. And so they're trying to get more information about that. The entity that is tracking that information in Georgia is relatively new. The executive director herself is new. And so I think that's what they're trying to figure out is, how can we help hospitals and healthcare settings better understand where nurses are working to try to bring them back, bring them to ERs if they're working somewhere else. I think that's the focus right now.
I know this story came to you just only a short time ago, so I can't imagine that it's that far along in the civil process. But where does the lawsuit stand right now?
So the lawsuit was just filed within the past couple of weeks. It is pending. And first, I want to say I'm very grateful to the family. Michael's mom lives in Long Island, New York, and she flew down for the interview. And man, she's such a lovely lady, and the family really having a difficult time. But she said she wanted to do this interview to show what are the true consequences when there are not enough staff, not enough nurses in ERs. And for her, and according to the lawsuit, these are the consequences.
Wow. And we know they'll keep Michael's memory alive fighting through this process. Thank you so much, Andy, for your powerful reporting. You've been watching and listening to Behind the Investigation with Atlanta News First Investigates. Be sure to watch or listen wherever you get your podcasts.